Hello everyone, this is Dr. Mansi from Homeopathy 360 and we are back again with another series on another day. And we have Dr. V. Nikhila Priya. She is dedicated to public health professional with a BHMS degree and an MPH and has been serving as practitioner with more than 4 years with experience in maternal and child health, environmental health, and disease prevention. She combines her clinical expertise with a passion for research and education. Her active involvement in Cochrane system reviews and research on gender disparities showcases her commitment to evidence based practice and improving population health outcomes. So, we are very happy to have you as our respected speaker in this series. Thank you so much, ma'am, for coming. Now, the platform is all yours. Please, please, ma'am,
Thank you, Mansi, for introducing me briefly. Good evening, everyone. Thank you for joining me today. And today I'll be talking about diarrheal treatment with the lesser known homeopathic remedies. I know it is 8 to 9 session. It is typically a dinner time for everyone. So I ask for an attention for next an hour. Kindly pay attention towards the presentation, and I know it is very well known topic and everyone are very familiar with it, but yet there are some hidden remedies and like conventional treatment that are surprisingly effective. We know they are common, but we need to there are some remedies so that we can practice in our clinic and for an effective cure. And as we all know, when we get if and someone or other speak about diarrhea, we might feel awkward or some kind of uneasiness due to its connection with bowel movement or a stool consistency. So if we hear such words, we feel a kind of sensation. So, but it is quite important topic for the public health and as well as health awareness one. So let us get into the topic today. Before starting the session, I just want to ask, is a diarrhea disease or a symptom? Can anyone answer in a chat box or can anyone speak up? Is a diarrhea symptom or disease? I can see one reply that it is a symptom. Good. And any other? Okay. It is, as we all know, diarrhea is a it's a symptom. Actually, it is not a disease, and symptom it is for many other disease conditions. Can anyone name what all disease condition where we can see diarrhea as a symptom? Any one of the disease? I think everyone are in supper time and dinner time. Okay. We can mostly we'll see diarrhea symptom. Yeah, diarrhea symptom in disease conditions like diarrhea. Yes, one of them have answered it correctly. Diarrhea, typhoid condition, any kind of infectious diseases like parasite or viral conditions, and Shigella, we can see celiac diseases, foodborne illness, and malabsorption condition of bile, bile juice and all. And post-surgical condition, we can see in a case of gallbladder removal. It is a very new one, even newly learned, even myself. And we can see due to stress and anxiety also. So as we all know, it is a huge kind of huge condition, but we can see the symptom even in IBS. Can anyone name what is mean by IBS? IBS and IBD. What's the difference between IBS and IBD? Okay, IBS is an irritable bowel syndrome, and predominantly it is seen in IBS D, which is diarrhea. And IBS-C is constipation, which may not be talking about much, but today we'll be talking about IBS-B and IBS mixed and U also. And IBS-D is an inflammatory bowel disease. In these conditions also we can see diarrhea as a symptom. And before me getting into the deeply into diarrhea and remedies, let us talk about the physiology of diarrhea. Do anyone know or heard about what is the physiological mechanism caused by diarrhea? What are the physiological mechanism involved? Why it is caused? Any guess? No one, I think. Okay, let me tell you. There is a physiological mechanism why diarrhea occurs. It is caused due to imbalance of an electrolyte absorption and mechanism. It is divided into three parts, three types. It is. Let me show you on the whiteboard that how it has been. So physiology is divided into three parts. That is secretory ones, other one is osmotic ones, and next one is inflammatory ones. Right? Under secretory, what secretory condition like what happens is there is an increase in chloride secretion, due to which there is an increase in water absorption, as well as there is a movement, food movement. So there will be an increase in mortality condition, due to which gut movements will be increased. So it leads to diarrhea. This is one of the cause of diarrheal condition. Other condition caused by osmotic. What is mean by osmotic? Can anyone say what is mean by osmotic? Like from the like the due to pressure from higher pressure to lower pressure, right? So in osmotic one, what happens is in the lumen, like in the intestinal level, what happens is uh, all the food particles like non-soluble food solvents like lactose or artificial sweeteners, whatever we call it as sorbitol or any kind of food colors, these are non-soluble. So what happens due to non-solvent, if anything, something is big, what we need to do due to, we need to push it, right? So similarly, due to heavy molecules, there is a push, there is a requirement of water. So due to which all the load will be moving forward into the lumen. This causes diarrhea. This is one of the mechanism. Other mechanism is an inflammatory. Inflammatory, what happened? There is a damage of the mucosal layer. So due to which there is an fluid as well as protein loss, due to which we get mucus diarrhea and bloody stools or blood with stools and stool which is of slimy kind of sensation. This is one of the cause. And other cause other mechanism is like if we take any kind of antibiotics, consumption of antibiotics a large amount, what happens is there is an damage to the layer, and as well as there is an gut microbes will be altered, due to which we get diarrhea. This is the philosophy. This is the mechanism and physiological mechanism of the diarrhea. Now let us get into different types of diarrhea. And as we all know, since we learned the physiology, we know it is caused by secretory, osmotic, as well as inflammatory. In all this, there is a common thing is fluidity of the stools. So definition comes like this: diarrhea is characterized by the increased bowel movement and as well as increased fluidity of the stools, that too more than 3 times per day. This is a standard definition. And coming to the types, there are 3 types: acute, chronic, and traveler's diarrhea. So we all know what acute diarrhea is. Acute diarrhea, which lasts for less than 2 weeks, and it is caused by sudden onset, and there will be a loose watery stools. So it is any kind of infections, like if we eat any outside food, or if we eat any kind of food colored ones, or any kind of such things, food poisonings will happen, right? So that is an acute diarrhea. It lasts for less than 2 weeks. And whereas chronic diarrhea, it is more than 4 weeks, and it may be due to underlying disease condition. It may be due to pancreatic insufficiency, or it may be due to endocrine disease, or it may be due to IBS or IBD. So, due to which conditions last more than 4 weeks. And whereas traveler's diarrhea, it is the most common one, everyone has been experienced when we travel from one city to other city because of change of food or any kind of unhygienic conditions, or due to which individuals suffered with loose and watery stools, right? So it comes under traveler's diarrhea. Coming to the uh, prevalence, like epidemiological condition, it can cause for anyone, both the sexes, male and female, and it affects all the age groups. But most commonly, we see in children's of under 5 and elder group of above 60. Because of in children's, it may be due to lactose intolerance or any kind of endocrine diseases. But in adults, it is due to gut mobility will become loose as the age muscles will be emaciating. So due to which there will be a malabsorption, and diarrhea can be seen in that. And according to WHO, around 1.7 billion cases of childhood diarrhea cases can be seen annually. In adults, it contributes around 3 to 5% of global adult mortality rate. And can anyone say when cholera has attacked recently, currently in 2024 in Asia? In 2024, cholera outbreak has been occurred in August 22, and more than 2,400 deaths has been occurred across 22 countries, including Asia. It is Afghanistan. In Africa, it is Ghana and Sudan. So you can see those updates in the WHO website. Can anyone name any vaccine related to control for diarrheal control? Any vaccine that government has been included in UPI, like Universal Immunization Program? Any vaccine that will, and during childhood, can anyone remember what's the vaccine name? So it is rotavirus vaccine, which will be given for the kids. And in India, it is under UPI, Universal Immunization Program. It will be given at 6, 10, and 14 to prevent all these diarrheal conditions and acute diarrheal conditions caused by the virus. So let us look into the common causes. What are the causes? Based on the type, I have been categorized based on the type. What are the causes for diarrhea? Among acute diarrhea, we have viral, bacterial, parasitic, due to antibiotics and foodborne illness. For viral, we have norovirus and rotavirus. Just now we have discussed regarding rotavirus immunization. And among bacteria, we all know because of Salmonella typhi and E. coli, we have. And parasitic, it is very less, but we will see these cases in Africa and all those places. Gridaria and foodborne and antibiotics are there. Among chronic diarrhea, we have IBD, IBS, celiac diseases, infection, and endocrine diseases may be due to hyperthyroidism or Addison's disease, any kind of colon cancer, or due to long-term medications, chronic diarrhea will be seen. These are the causes for the chronic diarrhea. Among travelers' diarrhea, we have bacteria known as ETC. Can anyone do anyone know what is the full form of ETEC? It is a well known for everyone. ETEC, it is an enterotoxogenic E. coli. It is a major cause for the traveler's diarrhea, even in children, due to unhygienic conditions. It will be occurring. And among virus, we all know rotavirus and norovirus, and food and water contamination. These are the causes for the diarrhea. Uh, Now we have seen the causes, right? So let us look into the remedies. What are the lesser known remedies for the diarrhea, treatment of diarrhea? What are the common remedies people prescribe for the diarrheal treatment? Can anyone name two, three? Very common. This is a very common condition. Can anyone name two, three? I just want the session to be interactive. So just name two, three remedies. What are the commonly prescribed remedies for the diarrheal treatment? Okay, it has maybe it's time consuming. So I'll only start with the remedies, lesser known remedies. Okay. Commonly, we may use like camphor. Some may use camphor. Some may use verat alp. Right. These are the common. Everyone know those. Everyone will be knowing those remedies. But lesser known remedies, we'll see like maybe old physicians or some of the experienced physicians may be using it, or we may read in materia medica during our graduation time or during masters also, but may not be remembering that much, right? So I just want to recap all those remedies which are lesser known for diarrhea once again. So let us look into the remedies first now. So remedies, like you can see here, we have colchicum autumnal, gamboja, chamomilla, elatrium, and we have epis. This is a very common remedy, but once again, it is a very less known remedy for us in diarrheal treatment. Picric acid, benzoic acid, gratolia, Seco, and we have iris, borax, croton trixlinum, and chinna mars. I think most of the 2-3 remedies are very well known for treating other conditions, but we may not be knowing that these remedies will be quite useful for treatment of diarrhea. So among all this, let me talk about colchicum autumnale, gambuja, and chamomilla, and let us also talk about on electrium. Among colchicum autumnale, I just want everyone to pay attention or just type in a chat box or just talk what what these pictures represent the condition. Can anyone guess what kind of stool or what kind of diarrhea will Cochrane autumnale will be indicated? Okay, we can see as like one of the member has wrote that it is for watery stools, right? Correctly guessed. And any other symptom you can identify through the pictures. Okay, let us continue with it. So first picture you can see there, it what does it represents, like brain is fogged, irritable, what to say, right? So in this condition, like in Colchcom, we can indicate person mind, like whose brain is fogged but answers correctly, and it is mainly for the dam changes, like person who frequently travel and eat food and all outside food. So for such conditions, for such person, and even for the sight of smell, like if they are having diarrhea more than 4 5 times, lose watery stools more than 5 times, even the smell, if you get the apple or anything near them, they feel like nausea like sensation. So that is one of the indication. And as well as due to the frequent stools and motion, what happened is their feet will be icy cold. Like if you touch their feet or stomach, they'll say it is like something emptiness, like cold sensation. So it is one of the indication. And as well as it is a condition where, well, due to when we make them to lie on bed, they'll be start picking the bed lining or the cloth or anything. So it is one of the common condition here for this remedy. As well as you can see here the stool sample, which is of jelly ones, jelly mucus, yellowish and dirty brown, and it is membranous shed. So it is the remedy given for the person who is having a frequent diarrhea of more often, like frequent watery diarrhea more than 16 times, bloody stools in a day, bled with stools in a day, and they will be emaciating gradually. So in one of the Clark, we can see that Nash has recorded Colchicum 200 has been has been given to an old lady for the treatment of blood with stools frequently more than 16 times in a day, 16 drops, and she has been recovered quickly within 3 hours. So one of the most effective remedy for treatment of such diarrheal conditions. You can use it in your clinic. And it can be compared with Gambusia veratrum alb due to its weakness and prostration. This one of the thing comparing, and it is antidoted by the ecanoid arsenic album and camphor and nux vomica. And next we have Elatrium officinalis, and this remedy is called as quitting cucumber. So such a weird name, right? So similarly, the symptoms are all of like that. First picture, what you can see is his brain is fogged. First of all, because frequent emaciation or frequent going passing of stools, he may not be in such consciousness and not be answering anything. So that is one of the indication. The second picture is the dampness wetting condition. So causation of the medicine, causation of the condition is due to dampness or dampness of the weather. And next picture you can see olive. So can anyone say what this olive indicates in the stools? Its consistency or its pattern or anything? So stools are like olive green. So and as well as it is frothy. Frothy means like a bubble texture, like dull, and it is of its smell. And you can see the water from here. It is quitting, right? So even the motion is also right. Immediately he hits, he will be rushing into the washroom. And so this is one of the indication. It is mainly seen in infant diarrhea as well as cholera uh, due to frequent motions. We know that cholera is rice water stools, but continuous motion will lead to this condition like dull olive green color and a feed one. And it is a bilious stools also. And this medicine will be compared to the cantharis. This is one other effective remedy I haven't mentioned here. So cantharis, it is compared because cantharis will be given for the dysenteric diarrhea with painful maturation. This is one more remedy, you can note it down. And potencies can be used here is 30 to 200 C. And in boric as well as in Clark, they have mentioned it, right? 1 to 20 pills or grams will be acting as a palliative for the person who are suffering with this condition. And it was also quoted by the Cooper also. In Clark, you can see in Clark Materia Medica, you can see this. And next, we have very common medicine given for children's, right? So, but this can be used for diarrhea also. So, chamomile, as we all know, everyone, it is a sudden, irritable condition, and they want attention as well as anger, indignation due to dentition, anger, indigestion, and pain. These are the causes for the any kind of conditions. And they will be irritable, thirsty, hot, and numb also. And we all know that kind of condition, like patients feel like people who are suffering with diarrhea, chamomile will be given when they say this dialogue, like I could die rather than suffer. So this is the one of the dialogue. When patients say such dialogues, we can choose immediately chamomile, uh, as well as when chamomile tool, like it will be hot, chopped green spinach, as you can see here picture, chopped green spinach as well as chopped egg, and even the smell is also like a rotten egg. So this is the indication for the chamomile. And even in Clark Materia Medica, we can see that even 5 drops of chamomile given immediately, we can see after 3 hours easy stools. That means normal semi-solid stools. Uh, by afternoon, if we give uh, if we give 5 drops, we can see easy stools after 3 hours. But if we give 60 drops with water after 3 hours, we can see easy motion in small quantity, like normal routine one after 3 hours. So this they have clearly mentioned in Materia Medica Clerk. You can go through it once again and read carefully. So we can use this medicine, common medicine also in our clinics for treatment of diarrheal conditions. Uh, and next medicine, I think most of them will be knowing this medicine, but may not be using that much. We may use very less frequently, we'll be using it. So my most favorite medicine, Gambusia. And first medicine like indicates, first of all, what are the indications we can see here is cheerfulness will be there. Even though frequent like tired, weakness is there, there'll be like face happy, smiling kind. they want to represent that, and there'll be a talkative. Even though they won't have energy, they'll be talking something or the other, so that they will feel happy and cheerful, so that they can recover quickly. And this is one of other indication. And due to diarrhea and all, they will have pitting pain as well as cutting pain, especially in the umbilicus. They'll be pointing it or showing it with the hand. Whatever he eats, whatever he drinks or eats, immediately he'll be rushing to the washroom, because it is very profuse, watery, gushing, and it is repeated. This which should be carefully observed. It is and repeated with, due to repeated, like continuous, they'll be going through the washroom, visiting the washroom. But after 10-15 times, at the 17th time, they'll be experiencing an green yellowish, uh, like fecal, with the mucus we can see. So it may be due to biliary action or biliary enzymes. And this is one of the indication, like any kind of food poisons, or any kind of allergens, if you are eating like any kind of food colors or artificial sweeteners, also will be getting diarrhea. So any kind of such if we consume, and even most frequently given, like will be given by the old physicians, is gambusia. 200 and 200 power as well as 30 power will be used. And that so indications for the gambusia is talkative, cheerful, and they want to recover quickly, and there'll be an pitting pain in the umbilicus. And whatever, immediately, even the water if he drinks also, he'll be rushing into the washroom. So marking word is gushing here, and repeated also here. And so profuse watery diarrhea, repeated gushing, and green yellowish mucus after some time will be seen. And due to frequent visiting to the washroom, they'll be having pain in the pockets. So back pain will be more common here. So next, after discussing the remedies, for 3-4 remedies, I just want to show some case scenarios, and I just want you people to guess what is the lesser known remedy given to these cases here. Kindly be attentive and uh, get your answer in the chat box. I just show you the video or the case of the patient, and just guess what remedy I have given to them. So can anyone guess for this condition what is the remedy I have given for this 52 years old woman suffering with chronic diarrhea? And in chronic diarrhea, it is particularly IBS-D. I need to mention it, IBS-D. And she has mentioned her complaints as every alternate day need to visit hospital, and intolerance to the coconut and food colors, cold drinks, and frequent profuse watery diarrhea. Can anyone guess what is the medicine given to her? The remedy given is as I shown in the list above. So any guess? Okay, I have received one of the answer as Gambuja. Any other guess? Okay, yeah, the one who answered is correct actually, because you can see in the video the woman is talkative. Uh, she is not like dull, like she is happily saying that, not happily I can say, like as she is okay. She is saying that I have been suffering these conditions since long time, but still I can grow. I can go to the life. I can do all the works and all. So that is one of the indication. And alternate day she is visiting hospital because it is so profuse gushing and it is repeated. This word should be noted here. Repeated one. So that is the indication I have given Gambuja, and we can see other medicine here. Then we'll see other case where 85 years old woman uh, case, and guess the remedy which I have given here. So here we can see an old woman case of 85 years with the same IBS case only, but it is not typically IBS. It is a mixed condition. Mixed IBS means 25% constipation and 25% we can see diarrheal condition here. So it is also an chronic diarrheal condition here. So can anyone guess what is the medicine given to her? Her indications is like weakness. We can see weakness, gushing here also gushing watery, but it is a mucus stool. Remember, prostration is there because she is an old woman, passing stools, and due to which she is having coldness of feet and all. And yeah, guess the medicine based on these conditions. Okay, the medicine given to the old woman is colchicum, because even if she smells the food, if we give a banana also, she's like, no, I don't want, because at the sight and smell of the food also she can't able to tolerate, and it is a main indication. And as we know, she's an old lady. Uh, Before I have mentioned that in Materia Medica, old woman case, Colchicum 200 was given. Similarly, I have tried for that woman. Colchicum 200 I have given. For 15 drops I have given with water, and she was recovered. Like third day, her motion was normal completely. Later on, she was under follow-up of the constitution medicine. So we have seen the case scenarios where I have used lesser known remedies. So let us next talk about what are the benefits actually. Like not only these remedies, all the homeopathic remedies, we know they are very gentle, and they are not an invasive techniques like any pricking or anything or external application. So there are non-invasive technique, and treatment is also non-invasive. And we know that they are addressing both physical as well as emotional triggers caused by due to diarrhea. Like emotional triggers, previously I mentioned they may be of cheerful or stress or any anxiety, such kinds, or any and these are the psychological conditions or emotional triggers. These also has been addressed, and you can see here one sentence: long term medical improvement without dependency. So medicines, like if we take, if some other person, or example, suppose myself, if I get treatment for diarrhea, I need to take medicines for allopathy treatment, because admission, nurse charge, any lines or anything, every time medications, because one time stool may not, like stool pattern may not be same all the time, right? So food and all will be different. So we'll be depending on our dependents, some or the other, mother, father, sister, or your husband, or some or the other will be depending on. So by homeopathy, what happens is this long-term dependency will be reduced by treating it with the root cause, like physical as well as emotional and mental symptoms should be taken into consideration before prescribing any medicine. So these are the benefits mainly. And next, along with the medicine, like we can't say that giving a homeopathy medicine completely cure your diarrheal condition or anything, because if any person with 10 to 15 times lose watery stools, lie down and say, I am tired, I don't want anything, just take homeopathy, you will be cured. No, you need to give sidewise management, like management, sidewise management or first aid also should be given along with your homeopathy medicine. So this is the foremost important. Alone homeopathy medicine or the allopathy medicine may not be curing your disease condition. This should be noted down. So sidewise, as everyone know, due to diarrhea, there will be an dehydration. So oral ORS should be used to maintain the electrolyte balance. And most of them may not be knowing this BAT, BRAT. Stands for banana. It gives B stands for banana. It gives proteins as well as improve, due to which your gut motility will be strengthened due to that proteins. Main source of peptin here, it absorbs water, and it also provide fiber. And banana is rich in potassium, so potassium will help sodium and glucose to maintain in the body. So that's why banana. And R is the rice, because it is in starch content, so starch is needed to bind the to bind, or to bind the molecules together and thicken the stools and reduce the fluid loss. So rice and apple as well as, it is to maintain the electrolyte balance, and oats is for the fiber content in the food. So this pattern, like BRAT diet pattern, is particularly standard one for diarrheal treatment by WHO. You can go through the WHO website as well as UNICEF, where you can see this BRAT diet. And but this diet should not be followed throughout. Whenever you have diarrhea or any such kind of cholera conditions, or any conditions, any kind of diarrheal symptom, you need to follow, but it should be followed for 24 hours or 48 hours only. So this should be, this you should be noted and understand it. Uh, we can't say public to eat always this one only, because it lack complete energy, and it may lack proteins, fibers, minerals, and vitamins. This is only diet which are which has been prescribed or indicated for the symptom relief and for temporary purpose, palliative purpose only. And probiotics. We all know probiotics like to improve gut bacteria for the speed recovery. So what kind of probiotics you all know? Do anyone know any probiotics you use commonly? Not the packed ones I mentioned here. Natural ones I want to know. What is the source for the probiotics? Okay, I can see one of it. Yeah, buttermilk, some other. Any one more? Like this is a common one. Each and everyone should know it is a basic first aid, right? So one of them has answered correct. Buttermilk, curd, even soya. Whatever soya is there, soaked soya paste. It also act as an probiotics that you need to know. So that also is a good. So even it is also a good soap to improve your gut bacteria and to maintain your healthy bowel movements and bowel pattern. And because uh, by age you are growing or by any other conditions, any mobilities, you are using medications. Due to medications, your gut bacteria will be reduced. So that's why you need to maintain gut bacteria. You need to have your probiotics correctly. Even there are supplements, but natural food is more preferred. And I have mentioned here one of the app name, what food map. So food map is an standard one, and it was standardized by the WHO, especially for the people with IBS, because they may not be knowing what food to eat, what food to avoid, or what food to consume and all. So it is an authorized app where you can go through your Google stores and download, and you can see there you have three colors there: green, red, and yellow. So which things to be avoided, which things to be maintained is the main thing. So these are the conditions actually curable when you maintain your lifestyle as well as like this food pattern and all along with the medicine. Every time, depending on medicine, may not be necessary, but these are the basic first aid things like everyone should know uh, for the treatment of diarrhea. So if you anyone want to know more about Food Map app, you can go browse through Google stores and you can learn many things there. And I just want to I just want to end up this session by giving a note that homeopathy offers a complementary approach for the managing diarrhea. So I wrote here complementary approach. So everyone should everyone should know that alone alone homeopathy nor alone allopathy or any kind of system alone may not be treating diarrheal condition. Long term diarrhea, acute maybe we may treat, but long term and all it is very difficult. So each and every system will need a support, right? So along with homeopathy, there is a management first aid system also, complementary approach for the managing diarrhea. And medicines, as before I have said, holistic approach. So physical as well as mental symptoms should be taken into consideration and individualized medicine should be given. So, and as well as we know that there are scientific evidence because I have previously mentioned there have been mentioned in Materia Medica as well as even sayings of some physicians like Nash and all and Cooper and all. So you can go through Materia Medica and you can observe their scientific evidence and holistic approach to ensure safe and effective treatment and care for the diarrhea. And if you want any references, here are the references where I have browsed through WHO site, and even I have mentioned Clark and Ellen's. You can go through those pages and see where they are there. And thank you for everyone attending the sessions. You do anyone have question? Any questions will be appreciated here. Or should I put my question forward and you people will be answering?
Yes, ma'am. That in that way, session will be more interactive. And it's my request, everyone, please ask your doubts, any questions to ma'am.
Or should I ask the question so that everyone will be answering can guess
Sure,
the
ma'am.
answer at
Sure.
least? Yeah, right. I just want to ask. Previously, I have mentioned regarding pancreatic insufficiency and post-operative gallbladder removal. There will be an diarrheal condition, chronic diarrheal condition. Can anyone say what is the link between pancreatic insufficiency and gallbladder removal condition? Linked, how it the both conditions are linked with diarrhea? What is the cause for the pancreatic insufficiency and gallbladder removal diarrheal effect? I'll be putting the question in the chat box so that you people can answer through chat box. So everyone can see have placed a question in the chat box. So can anyone answer or any guess for it? I know it's a dinner time, but I just want the people to be attentive so that you can have your dinner very effectively after an effective session. Okay. Okay, I'll be answering it how diarrhea is linked with pancreatic insufficiency and gallbladder removal post effect. So, pancreatic insufficiency, we know by the term itself, pancreas produce digestive enzymes. We all know it, right? Like lipase, amylase, proteinase, and all this. What these enzymes do, they break down fat, proteins, and carbohydrates so that it will be easily absorbed in the intestine. But due to mal absorption of fats at the colon, what happens is whatever bacteria is present, gut bacteria, it breaks down all the food particles, and due to which there is an fatty acids and as well as gas is produced. And because there are large molecules like fats and all are very large, so it needs some liquid or something to move forward and absorb, right? So more amount of water will be released and more amount of chloride like chlorine and transportations will be there, due to which water content will be drawn more, and we have due to which we have fat, oily and greasy, like stools are very mucus, greasy and oily texture will be there, and those are very offensive. So that diarrhea, like such condition is known as petinuria. It is caused by the fatty acids like malabsorption of the proteins and fats. And in such condition, we see fat soluble vitamin deficiency A, D, E, K. These are the fat soluble vitamins. So we can see fat soluble vitamin deficiencies here in such conditions. Coming to the gallbladder removal post effect diarrhea. In this diarrhea, by the term itself, we can see gallbladder function is to release bile. So what does bile do? It breaks down the food, right? And but here what happens, whatever bile is released by the gallbladder will be moving into small intestine to break down the fat for the digestion. But because of removal of gallbladder, release of bile will be directly into the intestine colon, and due to which bile acid malabsorption is there, excess of bile will be there in the colon, due to which mucosal damage has been occurring. So due to the mucosal damage and all, more amount of water and all secretions like mobility will be there, due to which movement of food is seen in the intestine. Gut movements will be increased. Due to gut movements increase, there will be an diarrhea. So it is an bilious diarrhea in gallbladder removal post effect. It is very watery, profuse, typical. Even after every meal, you need to visit the washroom. So it is an post effect. It is very commonly seen in gallbladder removal patients. So if you have any relatives or anyone, you can ask them, like they will be suffering with this condition. So it is very common because of gallbladder removal, malabsorption of bile will be seen. So this mechanism previously have mentioned under the physiology and mechanism I have mentioned. This condition will come under secretory diarrhea, whereas pancreatic insufficiency come under pancreatic insufficiency condition will be coming under non-absorbable osmotic diarrhea. So I'll be mentioning here types for your information. You can go through the physiological mechanism of diarrhea, like previously I've mentioned, secretory, osmotic, as well as secretory, osmotic, and as well as inflammatory. So under these conditions, I have mentioned it. So you can go through once again, and you can Google it, or you can see in PubMed also what are the post effects. So for your information, I have mentioned. So please educate your patients and all. So alone, none of the system will be treating alonely condition. So complementary, like as well as I use the term complementary, together system for alternative system plus basic management system first aid should be running parallelly to cure any condition. Thank you for everyone attending the session.